Hermetic shampoo and lotion for the last 3 months, and I can see great improvements in the thickness and strength of my hair. I would definitely recommend it for you.
Good morning, everyone. Welcome to this AM Upskills webinar session. My name is Georgia Seago. I'm editor of Aesthetic Medicine, and I am joined this morning by Dr Olivia Codrington, and George Brankov from Pharma Hermetic is also here in the background. This session is sponsored. Hi, George. This session is sponsored by Pharma Hermetic and PRP Lab, and we're going to be talking all about treating hair loss in clinic today. So, good morning, Olivia. Thank you for joining us.
Morning. Thank you for having me.
I am going to let you just get set up with your PowerPoint. And if anyone has any questions for Olivia during the presentation, if you could just pop them in the Q&A or the chat box, then I will put back on at the end and we'll have some time for Q&A. If there's anything more related to the Pharma Hermetic products, then please also do ask them. That's why George is here to ask anything slightly more commercial queries that you may have. So I am going to, we can see your screen, so that's all good. I'm going to disappear and over to you, Olivia, to talk all about hair restoration.
Thanks, Georgia. Okay, so today we are going to be talking about hair restoration, and this is in conjunction with Med Aesthetics, Pharma Hermetic and PRP Lab. So just to start off, a little bit about me. So I am a doctor based in Ealing in West London. I've been a doctor for 12 years now, and I'm a GP by background, but I've also been in the aesthetics industry since 2018. In terms of my interest in hair loss and hair restoration, I have both a personal and a professional desire to have products that can improve hair loss. So yeah, on a personal level, whenever I revise, I tend to pull at the left side of my hair and pull my hair out, which, you know, with the many exams that you do through med school, you're not really thinking about what your hair is going to be like in like the decades following. But I do have a visible thinning on the left side of my head compared to the right. So I've always been interested in what I can do to try and improve that anyway. I really like focusing on like health from the inside out, being quite holistic about things. So I optimize my nutrition and things like that, but it's not often enough. So that's my interest on a personal level, but then professionally, with both my GP hat and with my aesthetics medicine hat, I see a lot of people that talk about hair loss and the psychological implications that it can have on them. So, you know, hair is such a big part of our identity. In the past week alone, in GP consultations, I have dealt with quite a few people who've had hair loss and they're wanting to see a dermatologist because of how it's starting to affect their life in spite of everything that they're trying to do to minimize the loss. And then from an aesthetics standpoint, I obviously do injectables, I do PRP, all of these kinds of things that are there to help reduce the signs and the effects of aging to the skin, but hair can still be a bit of a giveaway with thinning, loss of pigment and things like that. So really, the Pharma Hermetic products have piqued my interest for both of those reasons. So I'm delighted to be here today talking to you about all of that. So we'll just start off very briefly. I mean, hair loss is like such a massive subject. So this is just at a basic level. We have alopecia areata, which is an autoimmune condition causing the hair to fall out. It usually happens in round or oval patches on the scalp, or it can happen in the beard, the eyebrows, or the eyelashes. We've also got androgenic alopecia. So this is like male and female pattern hair loss. And it's chronic, it's progressive, and affects 80% of men and 50% of women throughout their lifetime. And hair will fall out in a well-defined pattern in men, so the receding from the temples, whereas in women, it's more of a diffuse thinning. And so with me, with my left-sided thinning anyway, I'm noticing it even more now. Then we've got chemotherapy-induced alopecia, which obviously, you know, hair loss due to chemotherapy is such a distressing thing and such a physical sign of what someone is going through. And the hair loss happens because chemotherapy is targeting actively dividing and reproducing cells. So hair obviously is one of those. Then we've got telogen effluvium. So with telogen effluvium, more hairs than normal move into the resting phase, the telogen phase, and they shed. So you might notice more hair falling out than usual. It could be caused by physical or psychological triggers, so stress, poor diet, bereavement. You know, there's so many things going on at the moment that like hair loss, like lots of people are noticing it because of the stress that we're all under. Then traction alopecia. So this generally affects people with longer hair. So men and women with longer hair who are tying their hair back, pulling it in the same direction over and over. And yeah, so there's not really too much more to say about that. So let's move on. So as you may have already noticed, I divide like the way I think about things into like what I can do within the NHS and what I can do within my aesthetics business in terms of treating things. So when we think about hair loss and we think about the current NHS guidelines of what we can use, we've got finasteride and minoxidil. I do want to talk about those just for a minute because you know, you can obviously buy them over the counter in shampoo form and spray form, but they're not without their side effects. So finasteride, for example, it inhibits the type 2 5-alpha reductase enzyme, which converts testosterone to dihydrotestosterone or DHT. And that is implicated in hair loss and stopping hair regrowth. So obviously, finasteride blocks the action of that enzyme. However, in doing that, one of the potential side effects of using finasteride is impotence. So, you know, it's not without its risks. With minoxidil, that is a vasodilator which stimulates the flow of blood to the hair follicle, thus bringing oxygen and nutrients with it. But it can cause irritation, eczema to the area that it's being used, and it can have this paradoxical effect of actually causing further hair loss. So, you know, it's not to be taken lightly. One of the other methods that can be used, and this is usually by a dermatologist, would be a steroid injection into bald patches, or you might massage steroid cream into a bald patch. You can do immunotherapy, again, into the bald patches, or light treatment, or the more invasive side of things, such as hair transplant, where hair cells are moved to thinning patches. Again, extremely invasive. I've seen people in my GP work that have had infections post hair transplant. And so again, another thing not to be taken lightly, and could actually put quite a few people off from wanting to do something about their hair loss. Scalp reduction surgery. This is where a portion of the scalp is taken out and the hair is stretched to change the hairline, or even artificial hair transplant. So they're all the things that we're thinking of when we think what we can do in the NHS. However, in the aesthetics world, we have some other things that we can do. So UV light therapy, mesotherapy cocktails, scalp micropigmentation is becoming more popular. Growth factor based products, vitamin supplements, and then PRP, so platelet rich plasma. And I do want to talk to you a little bit about platelet rich plasma because it works so nicely in conjunction with the other products I want to talk about, and it has such wide-ranging effects. So just very quickly, PRP, platelet rich plasma. So initially it was used by orthopedic surgeons to help with the healing of joints and tendons. It's also used for the treatment of burns. It's used in the eyes. It's used for wound healing with diabetic feet. It's used in dentistry for tooth implants. However, in the aesthetics world, we use it for many things. So acne, rosacea, dark under eye circles, general skin rejuvenation, reduction of hyperpigmentation. And more recently, it can be used in aesthetic gynecology and urology for vaginal rejuvenation and things like that. So I would say, personally, I do a lot of PRP that's for people with rosacea or dark under eye circles. I get really nice results from that. So as I was already doing it anyway, I thought, probably should extend this skill into thinking about hair loss, because not only does it open you up to a wider range of patients, but it's also, as I said earlier, treating people's hair, not just their face, in terms of like ways to avoid looking as though you're aging. So the role of platelets. Platelets release growth factors, which are for cell growth, the generation and repair of blood vessels, the production of collagen, the production of hyaluronic acid, and the essentially promoting wound healing. So I'm not going to go into each one of these growth factors, because obviously we're not really here to talk about PRP, but yeah, you can see it all there. So whenever we have any kind of tissue trauma, we have hemostasis, which is where platelets, leukocytes, and fibrin all come together to form a 3D mesh. They release growth factor, and then they also attract macrophages and stem cells to the area of trauma. The stem cells proliferate by mitosis, and then they differentiate into the specific tissue that was originally injured to repair that tissue. So that's what our body does normally. So here it is in graph form. So wound healing without PRP, the length of time for hemostasis to take, the period of inflammation, tissue regeneration, and tissue remodeling. Now, it doesn't cut the healing time in half when you do PRP, or when you use PRP for wound healing, but it does dramatically attenuate it. So it shortens significantly. And I'll just leave that there for a second. Right, so with PRP, we are targeting stem cells to differentiate and produce the cells that we want to remodel, essentially. So stem cells are found in bone marrow, in fatty tissue, and they're very prevalent in the hair follicle. So now if we move on to talking about the hair cycle. So we've got the anagen phase, which is the active growth phase. And this is like approximately 3 to 6 years long, nice, healthy hair shaft. Then there's a transition phase, the catagen phase, which takes 1 to 2 weeks, where the hair is going towards the resting phase. And then we go into resting phase, 5 to 6 weeks, the hair breaks off and we lose the hair. So we can lose between 100 to 200 hairs per day. So in terms of hair anatomy, the main thing that we really need to focus on is the hair bulge. This is where the stem cells are. This is what we need to nurture to improve hair growth and hair restoration. So these are just some before and afters with just PRP alone. So after 4 treatments, you can see a thickening of the hair. Now, using a scalp magnifier, you can also see that this before and after, you can see evidence of, like say here, for example, where you only have 1 hair shaft coming out of the follicle, you've actually got like 2 to 3 that start to come out as well. So that's like part of the thickening effect caused by PRP. But now we will talk about Pharma Hermetic products and hair restoration using these topical products. So a little bit about the company, first of all. So it's a pioneer of hair biotechnology, and they are based over in Barcelona in Spain. However, they distribute to 35 countries over the world. They're family run, and they've got 20 years of bioscience and pharmacology background behind them before they produce this product. They use 100% sterile organic ingredients, and they specialize in hair care products. So the hair recovery program SP55, which is the range of products that we're going to be talking about, have featured in quite a few different areas of the media. So Platinum magazine, which is a magazine for the slightly older lady, and also Dr. Dawn Harper from Embarrassing Bodies had some positive things to say about the use of the SP55 program. So she said, alongside derma rolling to enhance the growth of hair in the follicle, it's a lot less invasive and less expensive than hair transplant and is growing in popularity. And it really is. It's something that opens up hair restoration to many of us rather than it just being reserved for people with very deep pockets. This is a little bit more. So this was from Aesthetics magazine in December of last year. Again, this will all be on the presentation that's going to be streamed. It's streamed live on Facebook, so you can go back and read these little excerpts if you would like. And then men's health in Poland. So, you know, we are far-reaching, really. So the hair recovery program SP55. So it consists of a anti-hair loss shampoo, which is for use at home, a lotion, again for use at home daily, and then the vials, which you use in the clinic with a derma roller. So 90% of hair loss in men and women is caused by genetic predisposition. And as I talked about earlier, we already know the role of testosterone and 5-alpha reductase is well defined in talking about hair loss. So DHT is synthesized from testosterone and it's converted using the enzyme 5-alpha reductase, which has been identified as the main cause of male pattern baldness. However, there is also an inflammatory component to hair loss. So at a scalp level, the hair follicle cell cycle can be interrupted with inflammatory cytokines, oxidative stress, telomere shortening, and cellular senescence. So if you think about the medical world generally, like chronic inflammation is implicated in so many different things, but I think it's really actually quite exciting that we've now identified it as one of the reasons that hair loss can happen is that we have to deal with the inflammation that's going on at the scalp level. So with that in mind, inflammation restricts follicle growth. It decreases oxygen and nutrient supply to the tissues that are prone to alopecia, leads to tissue degradation. Sorry, can't get my words out this morning. Speeds up hair follicle miniaturization, and eventually the alopecia speeds up. So the hair recovery program SP55, it's cosmetic. So first of all, this opens it up to people that are non-prescribers, which is excellent because it's a cosmetic treatment rather than a prescribable treatment. It's topical and designed for people suffering from hair loss, working from the outside to support the stem cells that are inside the hair follicle. It reduces inflammation of the hair follicle and gives a better supply of key ingredients for healthy hair growth. So what are those key ingredients? So peptides are the main thing that we will be focusing on. There's a chain of 8 peptides, there's over 150 amino acids, and then there are other organic natural ingredients such as biotin, caffeine, and lots of vitamins. So the mechanism of action of these products is to block the DHT and increase the activity of the telomerase in the stem cells of the hair, i.e. increase mitosis and differentiation to produce new hair growth. We also want to control and decrease inflammation using these products. As we said, that's certainly part of the hair loss problem is inflammation. We want to activate oxyaccident activity, remove free radicals, which we know about the effect free radicals have on the face. It's not really any wonder that the same kind of problem with free radicals can cause hair loss. And we also want to relax blood vessels, and so we can get more oxygen and nutrients flowing to the scalp to stimulate the growth of new hair and thicken hair that's existing. So how do peptides work for hair growth? Well, we know that peptides are involved in many physiological processes. They are in pretty much like every organ of the body. They're in every cell of the body. And they're responsible for the hair growth cycle, especially hair follicles, because they're a form of protein. Follicles need protein to produce hair. Without the presence of adequate protein in the body, it's difficult to achieve a balanced hair growth cycle. So peptides are smaller proteins. You apply them, they cause changes in the cell behavior at the scalp, on the scalp level. They stimulate the follicle to grow, and they promote natural hair production, and sometimes they even improve hair color. So where pigment is starting to go, like, people have reported that it's given them a vibrancy to their hair again. These are the different products. So we've got the vials that are for in clinic use with a derma roller. So you may have seen at the start of the presentation, we had a little video that showed someone derma rollering it onto the scalp and massaging it in. So ideally, you would want to do this once a week. However, at the moment, you know, with things the way they are, when we are allowed to reopen, I think everyone will be very busy. So if it stretches to be a treatment every 2 weeks, that's absolutely fine. And actually, it combines really nicely with PRP treatment for hair loss, and you would do them 2 weeks apart, and you know, get that compounding effect of like the new growth. We have the shampoo, which is a nice fruity smell for home use, like daily use, no side effects whatsoever, supporting the treatment, improving hair quality and strengthening the condition of the hair. And then we have the lotion for daily use, which has no smell. Again, it's like a daily use, and it complements the treatment in your clinic. You know, if we think about chemical peels, for example, we do chemical peels for people. We might do them a couple of weeks or up to a month apart, but we also want to optimize their home care routine and so that each time they come in, we're like one step further ahead in terms of sorting out their skin concern. The same applies to hair. There's no reason why, if you're having somebody into your clinic to do hair restoration PRP, and every other week you're then doing the hair recovery program with the derma roller or the microneedling device, there's absolutely no reason that you can't then be advising people to use the shampoo and the lotion at home, because everything is going to come together, and that compound effect is going to improve the results that people see. So from our experience, so personally, I have started using it recently. I am seeing changes. I'm happy so far, but I haven't been using it for a long time on myself, but I've got clients who have been really impressed with the changes that they've seen so far. Obviously now just using home care, but back to vials, hopefully in 6 or 7 weeks. So in our experience, HRP SP55 topical solution has helped our patients to reduce scalp inflammation. It boosts the better quality of hair growth, stimulates hair production in general, thickens the existing hair. It has no side effects and no rebound effects. So if we remember back to the beginning of the presentation, I talked about minoxidil and finasteride and the unpleasant side effects that can come as a result of them. For another product that is available without prescription, this is, you know, a very attractive looking alternative given no side effects. So this is just using a scalp magnifier and just looking from the screen from left to right over the course of 8 weeks. This is the improvement that can be seen in the hair. So, because we all love a before and after, don't we? This one I think is particularly impressive. This lady had chemotherapy-induced alopecia, and this was the hair growth that she had after chemo, because the hair often does grow back, like different color, different texture, etc. after chemo. So, you know, even if, you know, when you recover and your hair starts to grow back, it's often a very different quality of hair. So this lady used the SP55 treatment, and there's a really lovely result. So that's one of my favorite before and after slides, I think. In this one, obviously, like quite a pronounced bald patch there, and then take it from a slightly different angle, but you can see that there's been improvement in the hair regrowth there. This is another nice example. And a couple more, again, lovely example of before and after. So it's obviously more prominent in darker hair. But so if we then talk about the prices of these products, one of the other reasons why I was quite interested to get involved with them is because I thought they were a good price point. So so George, who is the Pharma Hermetic distributor in the UK, is also on this call, and I certainly I will defer to him to talk about treatments and costs and things like that. But obviously you can see here the cost of shampoo and then the recommended retail price, and the same with the home lotion. But yeah, as I said, I'll defer to George to talk about the cost side of things. I just wanted to give you the science background and why I've been so excited to get involved with these products. So if you do decide that you would be keen to offer these products to your clients, then you do get a lot of support. So stock images, descriptions, lots of before and afters, the SEO, posters. Yeah, so it's a, you know, a nice setup and like quite an easy thing to like add into your existing clinic. So then this is George's details as to where you would contact him. But I hope that was okay, and it was a bit of a whistle-stop tour of hair loss and hair restoration.
That was great. Thank you, Olivia. That was really interesting. We have quite a few questions have come in. As you say, that was quite a whistle-stop tour of what's a really complex subject with so many different facets to it. So the questions are quite varied, but let's get going. So some of them have come through from Facebook as well. So this one, first one, someone's asked, would you consider PRF as opposed to PRP, as the activated platelet count and integrity is higher in PRF than PRP?
I'm going to defer to George on that answer.
Specific PRP one.
So George, if you can unmute yourself, as you
are
very well versed in this.
Hello everyone. There is quite a lot of positive noise coming for a PRF at the moment, and I know there's a couple of companies that are championing this treatment. Yes, there are lots more platelets. However, we believe and has been proven that those growth factors are actually released in the PRF tube rather than actually being released in the scalp and injected. So we do believe and would recommend PRP over injecting PRF.
Okay, great, thank you. Okay, next one. What's the clinical evidence of the shampoo in supporting the growth of hair?
So basically all the ingredients, as Dr. Olivia mentioned earlier, they are 100% organic, natural products. So there's no chemicals. They're all a majority of plant extracts for all the products. There isn't a clinical evidence for the shampoo. The shampoo just drives nutrients and helps the actual quality of the hair itself. It is the peptide-based products that actually we have clinical evidence, and we're very happy to share with whomever is interested in a little bit more information. Obviously, we're quite short for time at the moment, so we can't really talk about too much. But yeah, very happy to discuss everything that is being asked about the product.
Great, thank you. This might be, I'm not sure who's this one is best to answer, but how soon after chemotherapy can microneedling be carried out on the scalp?
Mm-hmm.
Do you know, I'm not sure.
If I might just say this particular client, the chemo patient, I think she was, this is during chemotherapy, I beg your pardon, sorry. Okay. Yeah, so this is during her session of chemotherapy, so there's no, unlike PRP, which you absolutely cannot do PRP on a patient unless they're five years clear. with these topical products, because they're topical, there's no contraindications, there's no complications, so you can use them straight away.
Okay, so that can actually be done during chemotherapy.
Yeah.
Okay, great. And could you describe the method of administering the vials of the program?
Yes, so Olivia likes her pen device. We recommend a 0.25 microneedling device. We have rollers which can help the clients, or the clinics rather, unless they have some sort of a favorite device themselves. But yeah, anything that's 0.25.
So yeah, you just apply directly to the scalp and either derma roller straight over or microneedle to that depth, and okay, cool. Massage it in.
Great, thank you. Well, if anyone has any more questions, if you want to just try and get them in quickly, because we're probably going to have to wrap up soon. But yeah, the details for Pharma Hermetic are up on the screen if anyone wanted to get in touch with any questions. And Olivia, have you got any details you'd like to share about your practice, or if anyone has any questions about actually from a kind of practitioner point of view, maybe moving into offering these sorts of services?
Yeah, I'd be quite happy to talk to people about adding that into their aesthetic setup, definitely.
Okay, great. What's the best, is it like an email is best, or a DM or something to contact you?
Yeah, probably a DM through Instagram or Facebook. I'm just on as Dr Olivia Codrington, so quite easy to find.
I'm gonna just copy and paste that in case people have got any more questions for you. And George, is there anything that you'd like to add about training with Pharma Hermetic, or
so
working with the product?
To those who are familiar with who we are, what we do, and those who aren't familiar with what we are, who we are, and what we do, we provide PRP trainings, of course, and consumables. We're blessed to have a great number of KOLs. One of them is Dr. Olivia. She was actually recently trained, maybe a couple of years ago, on aesthetic gynecology, and I think we're sort of talking for her to start doing some training for us on also joints and tendons using PRP. We're quite prominent in the industry, and in terms of the topical hair restoration products, we believe that they absolutely complement PRP, and being, as I said earlier, natural, organic products with no chemicals whatsoever. It's just a no-brainer for your clients, in terms of your clinic clients, to use them, because there's great evidence and there's a great benefit, and of course there's zero complications and no pain because they're topical, and unlike PRP, which kind of tends to hurt a tiny bit, especially in the scalp. But my contact details, our contact details are there. Just feel free to get in touch. We give you all the support, all the marketing know-how, leaflets, posters, as Olivia was mentioning earlier. And we have a great team that will support and actually cater for you as a business, but ultimately cater for your clients who have pretty much, I have a bit of a here, so everyone has a bit of a sort of hair loss problem, and in terms of an industry is actually massive, and we are very well positioned to actually cater for that need out there.
Brilliant. Well, thank you so much, both of you, for joining us. Thank you for everyone watching and for your questions. And yeah, so this session was sponsored by Pharma Hermetic. And any other questions, please do pass them on to George or to Olivia. Thank you so much, everyone, and have a lovely rest of the day.
Thank you for having us. Bye.